I'm going to be demonstrating how to give an IM injection. First, I'm going to check my artery and compare it with my MOR, and I'm going to check for allergies, and I'm going to perform hand hygiene. I'm going to state the sites that you can give an IM injection. It's the deltoid, the ventrogluteal, the dorsogluteal, the rectus femoris, and the vastus lataris. So I'm going to check to verify with my doctor that these are correct, and I'm going to see the last place and time that it was given to the patient. So now I'm ready to go to my patient's. Now I'm ready to go to the medicine room. I'm going to perform hand hygiene, and I'm going to gather my 3 milliliter syringe, my appropriate size needle, my medication to be given, my cotton ball, alcohol prep pad, and my MOR. So I see that my patient is asking for morphine 7.5 milligrams, and it's an as needed drug. So I'm going to check to see when the last time they was given it, and I'm going to do some calculations. Okay, so I'm going to be administering 1.5 milliliters to my patient. So now I'm ready to gather my morphine. I'm going to check it 3 ways. I'm going to check it when I pull it out of the storage area, when I get ready to draw it up, and when I put it back. And I'm going to check the expiration date, and I'm going to check for any defects or contaminants as well. So now I'm going to take my alcohol prep pad. I'm going to clean it for 30 seconds. I'm going to take my top off. I'm going to pull back 1.5 milliliters of air. Okay, I'm going to push that into my valve. Push the air in. I'm going to draw up the 1.5 milliliters of morphine. I'm going to check the medicine to make sure that it is the correct medicine. And I'm going to put it back into the storage area, and I'm going to use my scoops technique again. Okay, so now I'm ready to go to my patient's room. I have my syringe, my cotton ball, my alcohol prep pad, and I have my MOR. So I'm going to knock on the door, introduce myself. I'm going to perform hand hygiene. I'm going to don clean gloves. So I see that the last place, and I'm also going to check for allergies, and I'm going to get the patient to state their name and date of birth and check it against their ID band. So I'm going to position the patient into a comfortable position, and I see that the last time they got it in their vastus lataris, so today we're going to give it to them in their rectus femoris. So I am going to take this alcohol prep pad, I'm going to clean that area off, let it dry, take my needle, and I'm going to go in at a dart-like motion. And I am going to aspirate before giving. I'm gonna push it in. Okay, I'm gonna take my cotton ball, apply slight pressure, and I'll put this into my sharps. Put a Band-Aid over it if needed. And I would position my patient back into a comfortable position, bed low and locked, and I would wash my hands. And then I would go document and come back 30 minutes later to check on my patient.